I welcome you all to the third part of module 4. Till now, we have discussed about sexuality education for youth and adolescents. In this part, we are going to discuss in brief common sexual problems faced by husband and wife. Counseling for sexual problems after marriage is and should be couple counseling, because both husband and wife are equally involved in inadequacy problems with which their marital relationship is contended. One should remember the fundamental fact that sexual relationship means interaction between two partners. It may happen that one partner will not get involved in counseling discussions, which can affect the therapeutic efforts taken by the counselor to sort out the issues. The reasons of non-involvement can be ignorance, then lack of knowledge and understanding about the intensity of the problem, and most importantly, absence of trust that counseling can solve their problem. But every counselor has to remember that sexual dysfunction and counseling for related problems are marital unit problems. Both the husband and wife have to be present in all the sessions. Many a times, husband approaches the counselor and hides this visit from his wife, even though they both are aware of the problems and both of them have discussed about their problems. Here his idea is that the counselor will do the magic and will cure him from his sexual disease. Hence, the counselor has to convince the husband the importance of the presence of his wife in counseling sessions. Sometimes wife says that what is her role in counseling when the husband is having problem? He should take the treatment, he should only seek the counseling and get cured. Here wife's attitude is just like an examiner, and as if the husband has to give examination. But this whole phenomenon intensifies his tension, which results in increasing the problem. This specifically happens with erection related problems, which are normally called as sexual weakness by many men. As we have discussed this in earlier part, this is a false notion which is developed due to fear complex, pressure of wife and total ignorance of physiology and functioning of reproductive organs. Hardly 1 or 2% of cases have got some physiological problems in their genitals, and hence surgical procedures are required. Hormonal replacement therapy may be required sometimes if physical problem is produced by endocrinal or hormonal imbalance. Otherwise, 98% of the problems are psychosexual problems, and for that counseling is the only treatment. These sexual problems can be classified as physical or psychological. Problems may be personal or social. Problems for men and women are also different, and some problems are premarital problems and some are postmarital. The first and foremost problem in couple is related to consummation of marriage, that is occurrence of sexual intercourse after marriage. In modern days, we all are worried about premaritals, free sex, then sex workers, etc. But surprisingly, it has been observed that married couples after few years of marriage also consult the gynecologist for getting conception have this issue of non-consummation of marriage. It means both husband and wife are not aware of proper technique of sexual intercourse. They might have known this process, but are ignorant of proper procedure. The reasons for this non-consummation are many. Sometimes wife is afraid of the intercourse. Sometimes wife cannot bear pain, so the process cannot be completed. Sometimes the problems can be tight foreskin in case of man and rigid hymen in case of women. In both these cases, some surgical procedure is required, and that is the normal procedure which solves the problem. But people are ignorant of such facts and misunderstand these problems as sexual weakness of a husband. Hence, proper examination, guidance and counselling is the only way to solve these problems. Few problems are related to various stages of sexual intercourse. Modern science considers 5 stages of any sexual act: sexual desire, then sexual arousal, plateau phase, phase of orgasm and resolution phase. First stage is desire, desire for sex. So, there can be total loss of desire for many reasons in men as well as in women. Person with lack of desire cannot enter into any of the further stages of the sex act. The earlier raw affair, anger about life partner, then feeling of cheating or any guilt and regret for something may lead to absence of desire of sex. Hence, for this proper psychological counselling is required. The counselor has to find out real cause by taking detailed history, as we have discussed in the earlier part, and then has to counsel the client. The second phase is arousal phase. In this phase, men experience penile erection. If we talk about the problems in this stage, then there are 2 types of problems in this phase. One is loss of erection, or it may be prolonged painful erections which are quite rare. People often misunderstand loss of erection with physical incapability or impotency, but this is not true. Erectile dysfunction is the proper word for such problem. This erectile dysfunction may be organic or it may be psychogenic. Up to 5% of cases may require surgical intervention, but 95% of the cases are because of myths and misconceptions about masturbation, then size of penis, fear of sex act, pressure from wife, ignorance about science and physiology of male female sex organs are the reasons for this erectile dysfunction. The similar factors also cause problems in next phases also, that is plateau phase. It means maintenance of erection during intercourse. Premature ejaculation means early ejaculation is the problem which can also the result of unnecessary fear and anxiety. This phase affects the last phase of sexual intercourse, that is orgasm. Orgasm is getting satisfaction from sexual intercourse. If a man cannot maintain his arousal, then naturally he cannot satisfy his wife. If he gets ejaculation very early, then also he does not get orgasm. And if it continues for some time, then the husband gets depressed. For understanding, the problems are divided into 5 phases which are interlinked. Now, let us discuss about some problems in females. Again, the 5 phases are important while thinking about women's problems. Problem in the first phase of desire, that is lack of desire. For many women, having desire for sex may be very difficult because of strictly sex inhibited upbringing, which may lead to guilt or shame about the sex act, fear of intercourse, then dislike for husband in arranged marriages, lack of privacy, addiction of husband, and sometimes the unhygienic habits of husband. This dislike can result into lack of arousal, and that affects vaginal lubrication, which is the characteristic of second phase of sex act. Absence of lubrication makes the intercourse painful for wife. This pain creates fear or rejection of sex at inner mind. Third phase is plateau phase. No desire, no arousal, which may create problems in sex act. This is the common reason for non-consummation of marriage. These problems keep the woman away from orgasm and it results into dissatisfaction in relationship. Many times husbands are not aware and they do not bother about problems of their wives, and then the wife not only experience dissatisfaction, but also slight compulsion for sex act. So, counselor has to focus on emotional attachment of husband and wife and care for each other. A wife also has to understand problems of husbands without putting any label on him such as important. And husband, he has to understand fear of wife for sex act and has to give her some time to adjust without putting the level of rigidity. Hence, the treatment of all these problems in male and female is removal of misconceptions, correction in wrong views about sexual intercourse and response. Apart from all this, to avoid sexual problems and to get deep pleasure and satisfaction, ego resolution of both the partners is essential. Stable and emotional relationship with the partner and friendly open communication is also necessary for healthy sex relation. Taking advice from expert or counselor is therefore the right strategy. Good sexual adjustment involves patience, passion and practice. To have a real sexual pleasure and satisfaction, only physical relief is not sufficient, but love and emotional intimacy between husband and wife is very necessary. This module is just an introduction of common sexual problems faced by husband and wife. This topic is very vast and one needs thorough knowledge of anatomy and physiology to understand all types of sexual problems. But a marriage counselor has to understand these basics so that he can refer the couple to the expert and can help the couple at initial phases of counseling. My wishes to all of you for learning next modules and to complete the course. Thank you.